It's no secret many children in West Virginia are overweight. A number of groups are tackling this problem, including an organization called Keys for Healthy Kids. DHHR is one of its partners. Joining me is the director of Keys for Healthy Kids in Charleston, Dr. Jamie Jeffrey. She is also a pediatrician, clinical associate professor of pediatrics at WVU School of Medicine's Charles Division, and medical director of Healthy Kids Wellness and Weight Management at CAMC. Dr. Jeffrey, thank you for being here.
Well, thank you very much for the opportunity.
I want to start with what we talked about earlier, which is Keys for Healthy Kids.
Right.
Tell us about that initiative and what that means.
Okay. Well, Keys for Healthy Kids is a little bit different than a lot of other initiatives because we focus on preventing childhood obesity, but we do that through policy, systems, and environmental change. Our two areas of focus is providing healthy food access to kids and their families and physical activity opportunities. So where a lot of programs focus mainly on education and health promotion and policy and what have you, we're focusing on that environment so that all that education can be put to use.
Now, can you tell us a little bit about how this is being successful? What are the kind of things that are happening out there in the communities that make this work?
That makes it work? Definitely collaboration and partnerships. We don't do anything by ourselves, so the collaboration and partnerships and bringing kids to the table are the keys to our success. Keys to our success, no pun intended.
Okay. I like it, I like it.
So, but I think some of our most successful initiatives have been in the early child care arena, and that's because we're focusing on children as they're developing their brain and their habits. And we've seen some of our biggest success in the early child care arena. Also in the school setting, we worked on a policy called Move to Improve, which wasn't adopted, but it was adopted by the Board of Education through policy 2510, which allows kids or gives them the right to have 30 minutes of physical activity throughout their school day. That's some of our two biggest wins, I would say.
Now, you have some props with you today, and I know that in the case of working with children, which is what you do, that it's important for us to think about how we do it in a creative way. Can you tell us a little bit about what you have here today? I know we're going to talk about exercise and nutrition.
One of the good things that with working with kids, it kind of makes my job easy. I get to go to work and be a kid. You just got to make it fun. And really, I think we need to apply that more to our adult learning model. But you just got to make it fun. So we have fun things. You wouldn't believe the things that we can do with just scarves, throwing up in the air, passing them under our legs, tons of stuff that you can do inside, outside, upside down. These are hula hoops, but you see they're smaller, so they're for our little kids to hula hoop, or otherwise I would ask you to do it and do it.
And I would have done it, too. I would have done it.
They're small, but we do have these in adult sizes, and we actually have these that are 4-pound hula hoops. So if you can't get outside in the winter, although you still can, right? There's no bad weather, just bad preparation. Absolutely. We have these things called snow boots, winter gear that we should all have in West Virginia, so no excuse there. And then the portion plate. And we're going to talk about all these as we talk about one of our favorite health promotion slogos or lines, and that's called 5, 2, 1, 0. You want to do it with me? 5, 2, 1, 0. That's right. That's what it's called.
What does it mean now? Tell us about it.
Oh, you want to know what it means? Okay, well, 5 stands for 5 servings of fruits and vegetables a day. So following along with your portion plate, which is everybody should know, is that you make half of your plate full of fruits and vegetables, and you should have 5 servings of those every single day. 2 hours stands for 2 hours or less of screen time. And that's recreational screen time, not used for educational purposes for our school-age children, but it includes every screen, which now we have abundance of screens, right? We have our phones, our tablets, our little tablets, our big tablets, our TV, our big TV, our little TV, our Wii, our video games, all kinds of screens that are just have inundated our kids' world. Where was I? 1. 1 stands for 1 hour of physical activity every day for our kids. That's the minimal. We really should focus on that just being the minimal, and that needs to be moderate to vigorous physical activity. Sweating, short of breath, red cheeks.
Really getting out there and doing the exercise, right?
Not this, not that, okay? And then 0, which is one of the most important and where I start most often in my clinical practice and where we need to start in West Virginia is 0 sugared sweetened beverages. We're consuming so many calories, empty calories and sugar calories with the things that we drink. Let's eat our food and not drink it.
Well, I love this. So, we were talking earlier. I was saying, I have a 4-year-old granddaughter, and I think that you can't start too early.
Absolutely.
In educating children about this, because I think they need to know. I think you make the point, if they don't learn it in childhood, are they going to do it when they're 21?
That's right. And to think about, one of the things that I think is so powerful is that early child care and early care and education is the arena where the kids are learning everything. Do you know the old adage, you learn everything you need to know in kindergarten?
Right.
Oh my gosh, I so often think how true that is, right? And I think about even myself and my personal habits. I have to work very, very, very hard not to clean my plate.
I think we're all in that category.
Right, that's what I learned because of the starving children in China, correct?
Right.
So if all of our kids had this, and they learned that there needs to be each one of these foods on their plates at every meal, especially the part about making half the plate fruits and vegetables, and maybe even having those fruits and vegetables coming from the garden out back or the community garden down the street, then all the stuff that we're talking about with obesity and diabetes and these chronic diseases that I'm now seeing in the pediatric population that I didn't see 20 years ago when I first trained, we're going to come a long way. And we've got that going on in West Virginia. We just need to turn it up.
I agree with you. It's kick it up a notch. The idea behind we've really got to focus our attention on this because it is a problem in West Virginia.
Absolutely.
I worry about fast foods. We talk to parents, we talk to kids, and we say, "Wow, everybody's busy. It's so easy to drive through." Mm-hmm. How do we get people to this 0 for the sweetened drinks, and the idea that fast food isn't always the answer to everything? What do we?
Well, it is the answer in West Virginia. If you look at how many fast food restaurants we have exactly in Kanawha County versus school versus other things, we have more fast foods than a lot of other places. What are you going to do about that? I was just in Boston. I saw one McDonald's the whole time I was in Boston. Okay, so there's something about those environments that have to take place, and that's going to be hard.
Very difficult. It's cultural change.
We don't even want to talk about that, right? Let's not even go there. I even feel the silence in the studio right now. But that's the tough questions that are going to have to be addressed. As far as getting to 0, really, it's quite easy. It really is. 4-year-olds are going to drink what parents and providers give them.
Agree.
So we can start in child care centers, pre-K, and Head Start. And they can be offered these 2 things called water and milk.
Right.
Yeah. Rocket science. That's what they can be offered. And then when they go on and go to school, what should they be offered? Well, let's go ahead and throw in the chocolate milk and the cookies and cream milk and the juice. Well, how about let's don't? How about let's give them and serve them and put in their environment what we want them to have? And that's what Keys for Healthy Kids works on. We work on changing that environment so kids automatically make the healthy choice by default.
I love it, and I love the idea, and I love what you're doing, and I'm glad that we're a partner and we can support you, and thank you for the work that you do and your team.
Thank you.
All right, we will be back, and when we come back, we're going to be talking about cooking some healthy meals fast. April Hamilton, who is a chef here in Charleston, will talk about meals that we can make for our families in the winter. We'll be right back.